Thank you, Pirio. Thank you for your hospitality. Tonight we are going to get into the deep water, to the cold water, and after that to the sauna. So if I don't survive, this is going to be my last talk ever. Basically, I was asked to give, again, a brief overview, and I think many of you have heard it, about ageism, just for the benefit of the people who are not part of our EuroAgeism program. And I will be talking about what ageism is, how prevalent it is, the consequences of ageism, and then I will try to relate it to our program. And again, I think many of the students have heard it before, but this is for the benefit of the people who have not heard it before. And I'm trying to put, I guess, the EuroAgeism program in context and explain to the audience why it is such an important program, I think, and why the topic of ageism should really be addressed globally, and to discuss some of the activities that we have been taking so far. So basically, ageism is really a multidimensional construct. It has stereotypes, prejudice, and discrimination towards people of any age group, actually. That's how it's defined. And it can be both positive and negative. So that I can think, for instance, that young people are making a lot of noise, and that's why I don't want to be their neighbor. That's an example of negative ageism towards young people. But I can also think that old people are having a hard time standing up on the bus, and that's why I will give them my seat. So that's an example of perhaps positive ageism, although it has some negative mindset attached to it as well, because I associate immediately white hair, for instance, with disability or with challenges standing up and so on. So it's really a complex phenomena that affects us in each and every aspect of our life. And it can be both explicit, so that I would say, oh, I don't want to go to the gym with these people because they're too young or too old. But it can be also implicit, so that when I reach, I don't know, the age of 40, I think that that's the time that I should stop going to dance clubs or something, just because I've reached a certain age, but I don't even tell it to myself. I'm not even aware of that, but it's something in me that is prohibiting me from doing things just because of my age, and I don't even tell it to myself. I don't even pronounce the thought in my mind, and that's why it's so challenging to really target ageism, because many times it's ingrained in us and we don't even stop to notice that. So I think that Pirio gave the example or the fact that Europe is aging, the world is aging, and this used to be the reason why I associated the topic of ageism and said that it's such an important topic because the world is changing. But the truth is that I don't think so anymore. Because right now, at this point, I really think of ageism as something that affects all of us. And it really affects all of us from the age of 0 to the age of whatever we live, because it's really discrimination, prejudice, and stereotypes towards people of any age group. And we're all somewhere along this line. And it affects each and every one of us in different ways. And I think that's why ageism is so important. Not because the world is aging or Europe is aging, but because we all have an age. And this age is associated with very many stereotypes, prejudice, and discrimination that many times inhibit us from really fulfilling our potential. And it does not inhibit only older people. It also has implications on the lives of young people and middle-aged people and children. So it's really a very pervasive phenomena, which should, I think, be differentiated from racism and sexism. We are not all going to be a black poor woman, but we're all going to be along this age continuum. And this is why ageism really is going to affect all of us. Not all of us are going to be affected by sexism or by racism, but we're all going to be affected by ageism, and we are all affected by ageism. So I think that's why this phenomena is so major in our life. And really, when you look at the literature, and this is this hand side, I mean, I think it's definitely changing, I have to say. But overall, there's been less research attention up until a couple of years ago towards the other, towards racism, ageism, compared to the other two big isms, ageism and sexism. No, sexism and racism have received a lot more attention, compared to ageism in the research up until a couple of years ago. But when you ask people, and this is based on the European Social Survey that had about 60,000 people from 29 countries, when you ask people to report their perceived experience of discrimination, a third of the population reported experiencing ageism, but only 17% reported experiencing racism. So it's really a very pronounced, very pervasive phenomena that has not been acknowledged as much in the literature, but also not in policy. And this is why EuroAgeism, I think, is taking place and is really making an impact, and I will talk about that in a few more slides. When we look at another survey, the World Values Survey that had 57 countries, over 80,000 people, again, 60% of the people thought that older people are not respected in society. And this was more likely to be reported in higher income countries. And you could have many different explanations for why it is happening in higher income countries. Again, we're asking people about their explicit perceptions. It could be that in higher income countries, people are just more aware of this phenomena even, and therefore are more likely to report it. Whereas in lower income countries, people may not be even aware of the phenomena, and they might be discriminated just as much, or might be discriminating just as much, but they don't look at it as discrimination. So it's really a question whether or not ageism really is happening more in high-income countries compared to low-income countries, but at least this is based on the World Values Survey, and it's us to interpret it and to make sure that these findings are really meaningful. But definitely the number of 60% of the people saying that older people are not respected in society is an important number for us to acknowledge, because it really shows a problem. And I'm going to briefly talk about three theories at the micro, meso, and macro level of why ageism is so prevalent. And I picked these theories at the micro, meso, and macro level because I think, again, it really attests to how ageism occurs at each and every aspect in our life and is so multidimensional and really has effects at the micro level, at the meso level, and at the macro level. So a very prominent theory at the micro level is the terror management theory that talks about ageism as a result of the fact that we associate death with older people. And basically, we all want to live forever. We all want to believe that we are going to live forever. And the fact that we meet vulnerable people kind of puts it in the face to us that life is not forever, that we are not immortal. And we try to shed away from people who bring this message to us by their vulnerability. And old age is associated to some degree with vulnerability, because we do know that at some point in old age, people do have more sickness, more disability, and we're trying to shade away from that. So that's one theory that tries to explain why ageism occurs at the macro level. At the meso level, there are theories that talk about how our entire life is differentiated based on age. My kids go to kindergarten or school with kids their age. Then when they go to university, it's going to be with people their age. They're going to work with people their age, and they're going to retire with people their age. So we have very, very little contact with people in other age group. And there is research, again, based on the European Social Survey that shows that there is very little contact for people with other age groups. Very few people, like around 10%, were reporting that they have friends who are in their 70s, people in their middle age or younger. So if you don't have contact with people in different age groups, they're always going to be the out group. And they are the out group, so you don't like them as much because you like your own people, you understand your own people. And we really structure life according to this age structure. I do have to say that EuroAgeism, again, now in retrospect, is quite ageist. If I had thought about it in advance 2 years ago, I think that I would have liked to put also some projects that address ageism towards younger people, because I really think that this is the way to go. Not to think of ageism as affecting only old people, even though definitely there is more evidence to show that it is occurring more among old people. But I think it's actually really, really important to make this connection, not only in real life to integrate young and old people together, but also in science. So I think this is a very important direction for us. And when I go to research conferences, it's always conferences for gerontologists, geriatrics. I always talk to people who study my own age group, so I'm ageist as well. And I think that in order to combat ageism, we really need to break this dichotomy along the age continuum, also when it comes to research. Then at the macro level, a very prominent theory, though it has been criticized dramatically, is the modernization theory that really talks about the fact that as a result of modernization processes, young people have left to the cities and have kind of kept the old people back in their villages or suburbs and so on. And older people have become redundant because they don't necessarily have the same skills to access technology as young people. There are more and more of them, more and more older people as a result of technological innovations and medical innovations, but they are not anymore the survival of the fittest. It's not necessarily the most healthy and well-to-do people that survive to old age, but pretty much everyone survives to old age, and then we see more frailty as a result of these modernization processes. And the role of older people in modern society has become less defined. If they, before that, used to be the people who kept the tradition and kind of told the story of the family, of the village, and so on, now we have prints. We don't need them anymore. So that's a theory, really, at the macro level, that tries to explain why ageism is so pronounced. And here I'm going to very briefly touch on to a couple of examples of how ageism plays a part in each aspect of our lives, at the macro, at the meso, and at the micro level. And I have to say that it's actually so pervasive and so pronounced that whenever I give this talk, I have people who come from different fields who talk with me about their experience of ageism in their own field. So I did not have a chance, for instance, to bring a slide on that here. I will do it next time I give an intro to ageism. But a friend of mine who's an artist came to me and said, Liat, we have to do something about ageism in art. And it's just there because all the most prestigious prizes are restricted to people of a certain age. But then she was giving me examples of very prominent artists, women artists in particular, who started to produce art in their 60s and 70s. So these prizes really restrict the development, and we can see here an intersection between ageism and sexism in the field of art. And I promise for my next talk, I will also have a couple of examples of how ageism is manifested in paintings. And it's pretty amazing. Once you open your mind to see ageism, you see it everywhere. But I will give you here a couple of examples. I will start from the macro level, the meso level, and then the micro level of how ageism is manifested. I think a very prominent place, and Age Europe has been protesting this, is really the fact that there is really no explicit acknowledgement of the prohibition of age discrimination in UN treaties. And this is this quote is taken from the UN Convention 70 years ago, and you see that they have acknowledged everything but age as a ground for non-discrimination. So I think that we still have a long way to go at the policy level. And here, if you look at the way age is being talked about at the European level, again, it is being talked about as a burden. And I am part of a group of researchers from European academies who are trying to develop a policy paper for the European Commission on the future of aging. And when we first met, the person who was leading this group, who is a geriatrician, was saying, we're going to talk about the problem of aging. And he was presenting photos, like he tried to divide the report into the older people of today and older people of the future, and kind of give a perspective on these two topics. But the older people of today were in black and white, and older people of the future were in colors. So really, I would say that ageism is so ingrained in us, and this group is really coming together to do good things. We're all coming together to do good things. But this is where ageism is so implicit that you don't even notice it. And when you call age a burden, or when you call age a tsunami, you're really putting it in a negative context. And it's very difficult for us to move away from this negative context. And I think this is really the direction that we have to take if we want to make a difference. And it's a little challenging also at the policy level, because sometimes it's easier to sell your policy or to sell your topic if you talk about it as a problem, if you talk about it as a challenge. And I think we really need to change the discourse here in the way we view age and aging. So that's really a challenge for us to change the discourse, because I think it's been ingrained in us for a very long time. This is another way to view ageism, and this is a study that was done with a colleague of mine that is an architecture and an urban planner, and she wanted to see how ageism is manifested in the urban environment. And basically she was taking photos 360 degrees of roundabouts where older people used to sit and interact. And what she found was that there was very, very little engagement between young and old. So older people came to these places and they were sitting there, and there was very little interactions going, because the young people, when they were in the photo, they were on the go, whereas older people came and they came to stay. So I have 3 minutes and I'll be fast. In the healthcare system, we see ageism in multiple ways. We see it in this context of the question, do older people have a duty to die? Thinking that maybe if the cake is that small, and we know that as people become sick and as people become old, they become sick, then maybe we have to ask whether they deserve less services. And even if we don't ask that explicitly, in many of the health programs, this is being done, so that older people are less likely to be sent to rehabilitation, less likely to receive expensive or innovative treatment, and it really affects older people's life. And this is an example for how ageism also plays in the way we think about people simply because of their age. So this is a student of mine that was given social workers 2 different vignettes, one of a young person, the other one of an old person. And what she found was that the attitude was completely different, and the people received the vignettes at a random order. So really it's kind of like an experiment. And what she found was that the old woman was less likely to be seen as being exposed to abuse, even though it's the same story. Yet, the social workers wanted to work with the young woman who was, and they preferred to refer the old woman to police and law enforcement agencies. So it really shows, I think, how we have a different approach towards different cases in the social arena, in the health arena, simply because of age. This is a study that was conducted by Becca Levy recently, and what she was looking at was to try to quantify financially the effects of discrimination with regard to the 8 most prominent conditions. And she reached a number that is quite enormous, $63 billion. That's the annual effect, annual financial effect of discrimination towards people. And she looked at 3 types of discrimination. Discrimination aimed at older people, negative age stereotypes, and negative self-perceptions of aging. So ageism is really even financially, has financial consequences in the healthcare sector. It also has substantial consequences in the workforce, where older people are less likely to find a job, but I'm talking here about people who are in their 40s, so it's not necessarily older people, it's also young people who are having a really hard time finding a job, getting training on the job at a certain age, and so on. And finally, really, also in the media, we see ageism and sexism, and it really has, I think, a pronounced effect where women are expected to kind of hide visible signs of aging, whereas men are allowed to keep those. We all have our own biases, And when I ask people to think of a witch, they might think of an old witch, not necessarily of a young witch. So that's our own implicit bias towards age. And it starts at a very young age. It starts when people are very little. And I always give the example of my son who really knows what ageism is. And you cannot say that about every little child in Israel. Yet, when he's asked to describe an old person, it will be like that, even though he does not have any image of an old person like that in his family or environment. He still really has a very implicit image of what age looks like, what old age looks like. And the problem is that it affects us throughout our life. So the way we think about our own age and aging has an impact on our health and well-being. And there is a lot of research done that shows that people who think negatively about their own age are likely to die earlier, are likely to have more disability, more sickness, more falls, and so on. So really, we need to do something about that, and this leads me to my last couple of slides that describe what we've been doing. And basically, as part of the COST action, COST is a European funding mechanism that really provides money for researchers to meet together. So we've been meeting together, around 200 researchers overall from 35 countries, around a common goal to really both understand ageism at the research conceptual level, but also to make a tie between policy and research. Because ageism is not a phenomenon that can be theoretically studied and put in the closet. It really affects each and every one of us, and that's why it really has an applied aspect that has to be addressed. And we really aimed towards that, and as Pirio had mentioned, we collaborated on a book, a special issue, and also a PhD program, which is EuroAgeism. And I would say most of the audience here is part of the EuroAgeism program. And the idea behind this program is really that because ageism is such a multidimensional phenomenon, research has to be multidisciplinary. So we have to bring in people from different disciplines. And among the faculty that are working on EuroAgeism, there are sociologists, economists, people from policy, pharmacology. It's really very, very diverse. It also has to be intersectorial, again, because we want to tie research with policy. And I have to say that the idea of tying research to policy came to me when I was attending a conference on making a connection between science and policy. And I've always believed in it, and I've always wanted to do that. And when I was at the conference, I've realized that my mind shuts off when I hear the policy stakeholders talking. And I think it's because I don't have enough training in listening to policy stakeholders. I come from a different culture, and I think differently. And I realized that in order to make this connection, you have to teach yourself how to listen, how to work with policy stakeholders, and vice versa. Because I remember that when I was giving a talk that I thought was completely basic, applied, and so on, the feedback that I got was, oh, you're talking about research, but what are the policy implications? What are the applied implications? And that's the message that I got from policy stakeholders. So I think there is a divide that needs to be, a bridge that needs to be made between policy and science. And this is another goal that is in the EuroAgeism project. And finally is the international aspect, because really, as I said, ageism affects all of us, all countries, all people. And that's why there is a need for the connection. These are the stakeholders involved in EuroAgeism. And I think that we try to address a variety of challenges in this program. As we've already talked about, there is the demographic changes that really mean that. And this program is really talking about the negative aspects of ageism towards older people. So there is the demographic changes that really are a challenge, I would say, in society today. Ageism has real life implications, and it affects us as researchers. So it's harder to attract people into the field of gerontology and geriatrics, even though I always tell my students, this is really the startup of the 21st century. It's still hard to attract people into this field, and these are some of the challenges. And in order to overcome these challenges, I think that really we need an innovative training program that tries to combine different disciplines and really allow students a variety of career paths, some in research, others in policy, and some along this bridge between science and policy. Really, the expected outcomes are that we will be able to have a fruitful dialogue that I think we will be establishing today, because today we will be hearing lots of policy stakeholders. So we are hoping for a fruitful dialogue that will evolve as a result of us meeting together, listening to each other, working together on research, on policy, and really learning how to use the best in each of these sectors. And eventually also to develop policies based in evidence in the field of ageism. I know that I'm going to be kicked out of the room in a second, but if you let me 2 more minutes, is that okay? 1 more minute. Okay. So the students come from really a very international, I guess, many different countries, many different perspectives, many different disciplines, and they really, as you see, try to address ageism in a variety of domains, sectors, worldviews, and I think this is the beauty of the program. I want to conclude with the WHO campaign, which I think is actually a very, very promising next step, both for the EuroAgeism program to collaborate on, because this campaign is really evidence-based, and the idea is really not to do anything before you have the facts, which is exciting from a research perspective, because I feel like we can really produce something that is valuable to this campaign. But I think it's also exciting for us as people in the world, basically, because the people who are working on this campaign and try to target a word for all ages, which sounds very simple but requires, I think, a lot of work, are people who are saying that one day they will be able to change the world, that the way we are talking about ageism now is going to be completely different in 2031 when this campaign ends. So the idea is that in order to create a social change, you need a lot of time, and EuroAgeism is really part of this campaign, and hopefully will be contributing and also benefiting from this campaign. But I think all of us as people in society are going to benefit from this campaign, and should all really try to collaborate on the goals of the campaign, to change the way we think, feel, and act towards people because of their age. It's a very simple slogan. If I had more time, I would have talked about how challenging it is actually to think through this campaign, but I don't have more time, definitely not. So thank you very much, and sorry for taking your time.